The topic of today's immunodeficiency, as you know, in immune system, four major components are there: B cell, which produce antibodies; T cells, which are used against the viruses or the fungus infections; and the complement system are there, the phagocytes, which are macrophages. So, in immune deficiency, deficiency in or breakdown of person immune system, an innate, acquired, or induced inability to develop a normal immune response, or you can say it's a group of disorder in which part of the immune system is missing or defective, and the body is therefore unable to fight with the infections, viruses, and the bacteria. And as a result of this immune deficiency disorder, one is getting more frequent infection. The types of immunodeficiency, it is divided into the two broad category: congenital one, which is genetic base, also known as primary, and acquired one, which is secondary. The immune deficiency occur in any of the four major components as discussed, like B cells, T cells, complement, and phagocytes. And the congenital immunodeficiency, which is genetic base, and if it is involving the B cells system, it involves the T cell deficiency, it can cause complement deficiency, phagocyte deficiency, and the cause is primary due to genetic disease. Amongst these, in primary immunodeficiency, in congenital immunodeficiency, talking about the B cell, specifically starting from the B cell deficiency, as you know, B cell produce antibodies. In this category, the number one is S-linked A gamma globulinemia, which is also known as Bruton A gamma globulinemia. In this disease, the patient do not generate mature B cells, and hence they are leading towards the deficiency in immunoglobulin, or the low level of immunoglobulins. It is involving the precursor B cells, precursor B cells, which will be going to develop into mature B cells. It is the one of the more common form of primary immunodeficiency. And when the antibodies are not produced efficiently, the patient is more prone to have recurrent infections, particularly for the bacteria and especially encapsulated bacteria. The important scenario in respect to examination point of view, the question is usually asked about, like it is S-link, or it is recessive, it is autosomal recessive, autosomal dominant. So it is S-link hypogammaglobulinemia, and the treatment of this is that if one is having the S-linked A gamma globulinemia disorder or disease, the treatment is replacement of the immunoglobulins. It means replacement of the antibodies. Prophylactically, intravenous immunoglobulins therapy allows most individuals to reach adulthood. All the congenital deficiency of immune related is affecting the young age, means around 6 months to 2 years or 4 years of age, and the secondary one, which are acquired one, and it's about the most common age is the adult age. This disorder is entirely seen in males, the important point, and the mutation is at the level of long arm of X chromosome. The disease usually does not become apparent until about 6 months of age, as maternal immunoglobulins are depleted after this age. In S-linked A gamma globulinemia, the precursor B cells are defected, hence all of the antibodies are decreased or depressed. In compared to this, selective immunoglobulin deficiency is also there, which are known as IgA deficiency. So it means IgA is not being there, or if there is not in enough quantity. So IgA deficiency is common, and you know it's basically seen in the mucosal lining, as in the GI tract as well, and the sinus lining. So when the IgA deficiency is there, so most of the infections are related to the lung, sinuses, and the GI and the GIT absorption effect as well, also be seen in this type of patients. The other is IgM specific IgG deficiency, which causes recurrent sinopulmonary infection caused by the Staph pneumoniae and H. influenzae or Staph aureus. Talking about the T cell, the important one is thymic aplasia, also known as Digeorge syndrome. It is a T cell deficiency that results from failure of the development of the third and fourth pharyngeal pouches. This is an important one. It is due to the failure of the development of the third and fourth pharyngeal pouches, and it is a T cell deficiency disorder. Recalling the embryological scenario, the fourth pharyngeal pouches made thymus, parathyroid, and some of the C cells of thyroid. So, if it is not there or its function is defected, the function of the fourth pharyngeal pouch is not working properly, and it's a failure of the development. As we said, that it is a failure of development of the third and fourth pharyngeal pouches. If fourth pharyngeal pouches is defected, and then we have T cell deficiency due to the hypoplasia or the lack of a thymus. We have tetany resulting from the lack of parathyroid, and the congenital defects of the heart and great vessels are also seen in this type of patient. The absence of cell-mediated immunity is caused by the low number of T lymphocytes in the blood and the lymphoid tissue, and poor defense against certain fungal and viral infection. If defect in the lymphocytes activation or its function, a term used hyper IgM syndrome. A hyper IgM syndrome is a disorder which affected patients make IgM antibodies but are deficient in their ability to produce IgG, IgA, and IgE antibodies. So, if you just remember the name hyper IgM syndrome, so in this type of patient, IgM body is there, but there is a deficiency to produce IgG, IgA, and IgE in this type of patients. So, recalling X-linked hyper IgM syndrome, there is a failure to produce isotype switch high affinity antibodies, which are IgG, IgA, IgE, and the mutation in the gene encoding CD40L. Combined B cell and T cell deficiency, if the patient is having, or the individual is having the combined B cell and the T cell deficiency, and then he is developing severe combined immunodeficiency, which is SCID SCID, and B cells and T cells are defective or absent in this disease. Or you can say that defects in both humoral or cell-mediated immune responses are there in these patients. So, affected infants present with prominent thrush, which is known as oral candidiasis, extensive diaper rash is seen in this type of patient, and failure to thrive. Some patients develop a morbidiform rash shortly after birth because maternal T cells are transferred across the placenta, attack the fetus, causing graft versus host disease. So this is not important for you guys, but what you need to know that severe combined immunodeficiency is related to the B cells and the T cells defection or the absent of it, and the number of cells may be normal but they do not function properly, and the patient is having the candida albicans in the form of oral thrush or candidiasis, and also present with the frequent extensive diaper rash. Ataxia telangiectasis is also having the B cell and T cell deficiency, and it is autosomal recessive cell disease caused by the mutation in the gene that encode DNA repair enzymes.
Deficiency in the complement system, then one present with the hydroangioedema, which is uncommon. It is due to the deficiency of the C1 inhibitor, which causes C1 to act continuously on C4 to generate C4A and C3A and C5A. And in this disease, the papillary permeability is increased, and due to this, the edema form in various organs. It is autosomal dominant disease. The deficiency of C2 complement system is the most common complement protein deficiency. Deficiency of C2 or C4 early components of the classical pathways associated with the increased bacterial or viral infections. C3 component of complement is required for both the classical and alternative pathways, and hence a deficiency of this protein results in recurrent infections, the pyogenic one, and that may occur. The terminal components of complement, which are C5, C6, C7, and 8 and 9, are required for the assembly of the membrane attack complexes involving the lysis of the organism. If this is disease or there is disorder in this terminal component of complements C5 to C9, then there is an increase recurrent Neisseria infections, as the Neisseria bacteria have thin walls and are especially prone to the lytic actions of the complements. The defects in the leukocyte functions, uh, like leukocyte functions uh, like Higashi syndrome, in which the recurrent infections are there, and it is due to the failure of lysosomes of the neutrophils to fuse with the phagosomes. In these decreased leukocyte functions, and it is due to the mutation affecting proteins involving lysosomal membrane traffic. In chronic granulomatous disease, there is decreased oxidative burst, and due to this, the intercellular microbicidal activity of the neutrophil is lost. Defects in the leukocyte function disease, if it's affecting leukocyte adhesion, and if the one is having the leukocyte adhesion deficiency syndrome, which is in this type of disease, there's a defective leukocyte adhesions to the endothelium, so the migration of the neutrophils cannot occur properly to the culprit site. Acquired immunodeficiencies, which are also known as secondary immunodeficiencies. The causes are HIV, human evidentiary-virus infection, in which depletion of the CD4 and the helper T cells occur, and other causes are radiations and chemotherapy, which are going for the treatment of the cancers or the lymphomas. Involvement of bone marrow by cancers with or by bone marrow tumor itself, like leukemia, which reduce the site of leukocyte development. Protein calorie maturation, which is metabolic derangements, inhibits lymphocyte maturation and functions, and the removal of spleen, decreased phagocytosis of microbes occur in these. HIV immunodeficiency virus, which is HIV, and characterized by profound immunosuppression, which leads to the opportunistic infections, secondary neoplasms, and neurological manifestation. Homosexual or bisexual men constitute the largest group, accounting for more than 50% of the reported cases belong to this. And intravenous drug abusers with no previous history of homosexuality are the next largest group. Hemophilics, if the one is having the factor 8 or factor 9 concentrates before 1985, they make up of 1.5% of all cases. Recipients of blood and blood components, as you know, heterosexual contacts are also in the epidemiological role in this. HIV infection of the newborn is also there, which is due to the infection transmitted from mothers to child. It is clear that transmission of HIV occurs under conditions which involving exchange of blood or blood-body fluids containing the virus or virus-infected cells, like sexual transmission. Sexual transmission of HIV is enhanced by coexistent sexual transmitted disease. Parental transmission of HIV has occurred in three groups of individuals: those who are intravenous drug abusers, and those who are hemophilics who receive factor 8 and factor 9 concentrates, and the random recipients of blood transfusions. Mothers to infant transmission is the major cause of pediatric AIDS, and the infected mothers can transmit the infection by three modes: in utero by transplacental spread, during delivery through an infected birth canal, and after birth by injection of birth breast milk.